welcome into your health. And we are really fortunate today because we have Dr. Paul Moore with us. Paul is a cardiologist, and he is one of the best. I just have known you for years. Everybody that goes to you loves you, and Montgomery Cardiology Associates love you. You're great. We thank you. And you're going to help us today about what happens to people as they age. One of the things that happens is your heart ages too. And we're going to talk a little bit about the aging heart. But first of all, would you please remind our audience how COVID doesn't just affect the lungs?
Sure. The COVID issue is so prevalent right now and such a huge problem, and the hospitals are full of COVID patients. The rates of positivity are sky high, and people are dying of the COVID right and left. So I think I do perceive that people are beginning to take it a little bit more seriously. I see people wearing masks. You must wear your mask. We started in our office wearing masks in early March,
right,
well before the CDC even recommended it. And the other measures are very, very important as well. Don't get into crowded areas. Don't, keep your social distance. All of those things are critically important. I read something the other day that the vaccine, and everybody's kind of hanging their hopes on the vaccine, would save 25,000 lives in a few weeks. Wearing your mask will save 50,000 lives. This is with the assessment of this particular study that I read actually several weeks ago.
Wow, that's interesting.
Yeah.
But
as far as aging of the heart is concerned, the cardiovascular system, of course, ages, and the manifestations of aging include graying of the hair and skin wrinkling, those sorts of things. But the heart cardiovascular system ages as well. And predominantly, I would characterize it this way: we get stiffer as we get as we get older, and as we age. The cardiovascular system tends to stiffen up, and our blood vessels become stiffer, less compliant, less able to be capacitance vessels. That means they're less able to stretch and to absorb the energy as the heart pumps. So what happens? Our blood pressure tends to go up with age. The heart muscle gets stiffer. And interestingly, not only does the blood pressure go up with age, but it tends to fall, or it tends to be more labile. Blood pressure goes up and down. And blood pressure tends to fall when you stand up as you get older, or when you change positions. So aging of the cardiovascular system leads to a lot of symptoms, and those symptoms can include shortness of breath. As the heart muscle gets stiffer, shortness of breath is a principal manifestation of that. High blood pressure I mentioned, and of course, as components of our heart age, those components tend to cause problems. As we get older, our heart valves tend not to be as pliable and supple as they were when we were young. One of the common manifestations of aging is to develop what we call aortic stenosis, and that's where the main heart valve out of the heart tends to become stiff and less compliant, and you can actually develop such severe aortic stenosis that the valve has to be replaced. The arteries become less compliant and stiffer, and that's really where the term hardening of the arteries comes from. And this, fortunately, we have a lot of technology and a lot of advances in medicine to deal with these issues. We still can't deal very well with stiff heart muscle or with stiff arteries. The main thing is to control the blood pressure and to control, to be very proactive with ways to keep your risk factors under control as you age.
Great. Well, you know what? We've talked about the aging of the heart. And one thing that is terribly important, you know, get that annual checkup. Get
Right.
your physical every year, because what happens is people don't pay attention. They just think, I'm a little bit older, maybe I'm just a little short of breath or whatever. But you know what? You just really need to go in and get checked, and your physician will send you to see somebody like you
Yeah.
who can help us live longer.
And that's really an important point in the context of COVID as well. People are afraid to get out and go to their doctors in the context of the COVID. And all sorts of studies have shown that by delaying those necessary tests, by delaying those necessary treatments, you really put yourself at risk for serious complications from your heart. We've had people die by postponing their necessary tests. And so in the context of COVID, you're a lot more likely to get the COVID in the grocery store or in the Walmart or whatever than you are in the doctor's office or in the hospital. The hospitals have a lot of COVID patients, but precautions are taken
That's
to
right.
avoid that. So
That's right.
do not delay if you're having symptoms. Do not delay if your doctor advises you to have tests.
Thank you so much for being with us, and we'll have you back, and we're going to teach you some of the things that you can do about these symptoms and these aging heart issues. Thank you, Dr. Moore. We appreciate it very much, and we'll be right back.